My name is Tangee Harris, and this is the making of my physical assessment video. Before you physical assess your patient or work with any patient, you should wash your hands. So that is what I'm doing now. I need to dry them. Okay, I have a young gentleman here. This is my nephew. What is your name?
Joshua Woods.
What is the year?
2019.
And where are you?
My house.
Okay, Joshua, the first thing I'm going to do is ask you, are you having any pain?
No.
Okay, Joshua, I would like to assess your head. At first, I'm going to inspect. I'm going to take a look and look at his head for the distribution of the hair all over his head. And he has a full head of hair. And I'm also going to look at his head, check the symmetry, and I'm going to feel for any lumps and bumps on his head. Any pain when I touch your head or rub your head?
No.
Have you ever had any head trauma?
No.
Okay, all right. The next thing we're going to do, Joshua, and I'm going to take a look at his eyes. Joshua's eyebrows are full. He has nice long eyelashes. I'm also inspecting the eyes to take a look at the pupil, the iris, the conjunctiva, the sclera. All landmarks are present, and they, the sclera, the conjunctiva, they're clear. I'm going to take a pen light, Joshua, and shine it in your eye to see how your eyes react to the light. Okay, his pupils are equal, round, and reactive to light. The next thing I want to do is look at Joshua's ears, and we're going to check the skin over his ear. I'm looking at the tragus of the ear lobe, the helix of the ear, the antihelix of the ear, and I'm going to look inside the ear. And you pull up on an adult's ear to get a good view in the inside. And I'm unable to see any landmarks in the left ear due to cerumen. And again, the earlobe, the tragus of the ear, the antihelix, and the helix and the antihelix of the ear. All landmarks are present. His skin is nice and clear, no lesions, no skin tags, no moles, but Joshua does have an ear pit right here on his right ear. And I'm going to look inside his ear canal, and I'm going to pull up on the ear, and I'm looking inside with the light, and again, I see the little cilia inside of his ears, but I cannot see any landmarks due to cerumen in the ear. Yes, cannot see the landmarks. Okay. Now I'm going to don my gloves because I'm going to take a look inside of Joshua's nose. But while I'm doing that, I can be inspecting the outside of Joshua's nose to see that the bridge of his nose seemed to be slightly crooked. You never broke your nose, have you, Joshua? Okay, so his is not perfectly straight. And then I'm going to take a look in the inside of his nostrils. And we're looking for any drainage, and we're looking to see that the nares are patent and no drainage. It's nice and pink there. Okay. Very good. The next place that I want to look is in Joshua's mouth. I'm gonna check Joshua's mouth right now. I'm checking the lips for symmetry. There's no moles, no gross lesions on the mouth. He has a mustache on top of his mouth, so I see the distribution of the hair, and then I'm going to check in the inside of his mouth. But first, I'm going to check the cranial nerves. And Joshua, can you puff your cheeks out for me? Like that? Okay. Now, Joshua, give me a smile. Okay. And Joshua, stick your tongue out for me. Okay. Joshua, could you please open your mouth for me and say ah?
Ah.
Okay. Open very wide, Joshua. While I'm here, I'm going to check the gag reflex. Okay. And it does work. He's got a good gag reflex. And then open your mouth, Joshua. Okay, I'm looking at the hard and the soft palates. Go off of me again, Joshua. I can see the tonsils. They're sitting correctly in the fornix. They're not red. They're not swollen. There's no pus. And then I look inside at the cheeks, and they're nice and pink. And I'm looking also at the teeth for dental caries or broken teeth. And then I actually will feel around in the bottom of Joshua's mouth. I can see the frenulum at the bottom and also the frenulum at the top. And his gums are clear. I'm palpating the gums. They are nice and firm. Any pain, Joshua, as I'm palpating the gums? Okay. And he has no loose teeth. All right, good, Joshua. Okay. All right. So the next thing that I would like to do, now that I've done that, is check Joshua's neck. So I inspect the neck, again for symmetry, check the skin on the front and the back for any lesions, nodules, skin tags, moles. Joshua's skin is clear. I'm going to hand Joshua the water. And I'm going to go behind you and assess your thyroid gland. What I want you to do is take one sip of water, but I'll tell you when. Okay, so I'll go behind Joshua and I'll put my hands in the groove of his neck. Okay, take one big sip of water. All right, good. And so you can feel it. It feels nice and soft, and it feels like a little flutter going up. Thanks, Joshua. I also want to check his carotid pulse. And you only want to check one side at a time so that your patient won't pass out. You don't want to cut the blood flow off to his head. Okay, very good, Joshua. Okay, now I want to assess your breath sounds, and I'm going to start at the posterior part of your back. Take a deep breath for me. And out. Will you letting it out? In through your nose and out. There you go. So Joshua's lungs are clear bilaterally and posteriorly. I did not mention that I'm inspecting his back basically for any lesions, skin tags, moles, scarring, distribution of hair, which he has a little hair on his upper back. And now I'm going to the front of his chest, and I'm also going to check the skin and for maybe any like acne, moles, any lesions, scarring, or hair. And I'm going to listen to his lungs anteriorly. Give me a deep breath. And out. And out. And out. And out. Very good. And his lungs, they do remain clear bilaterally. We're going to move on to Joshua's heart. The first thing that I'm going to do is feel at the point of maximum impulse, which is at the 5th intercostal space. And I'm going to ask Joshua to lean forward a little bit for me, Joshua. Okay. And it's nice and regular. All right, you can sit back up. And I'm going to listen to Joshua's heart, both with the diaphragm and the bell in 4 places. The first place will be at the aortic, which is 2nd intercostal space, to the left of the sternum. The pulmonic should be 2nd intercostal space to the right of the sternum. The tricuspid should be the 3rd intercostal space to the left of the sternum. And then the mitral should be at about the 5th intercostal space, the mid-axillary line. Now listen again with the bell. Okay, now we're going to check the abdomen. So I'm inspecting the abdomen for symmetry, for any scarring, any lesions, nodules, moles, hernias, distribution of hair. And the next thing that I'm going to do is auscultate the 4 quadrants. And I should hear 5 to 30 gurgles or vowel sounds. A minute. or at least within 5 minutes. If there are no bowel sounds, to say there are no bowel sounds, you have to listen to all quadrants for at least 5 minutes. Also, on inspection, you want to notice whether there's any peristalsis or any pulsations of the aorta. The next thing that you do as far as the abdomen is concerned is percussion. Oh God, it's gonna be hard to do. Josh, can you lay back a little bit on the chair? To percuss the abdomen, I will lay my hands down like this, and I tap. And the sound it should make would be tympany, because there's air that fills the bowel, so that's what makes it sound like that. And then the very last thing is palpation. So you're palpating to see for softness, see if you feel any nodules. If the patient is having any pain, they will report it at this time. Feels okay? All right. Now we're going to take a look at Joshua's extremities. May I see your arm, Joshua? And we feel for the temperature, and you just check the skin. Any rashes, lesions, nodules, moles, scarring. You always want to make sure the joints are working appropriately. Look at his hands, check the cap refill. It's less than 3 seconds. And same thing as the joints. Sure everything is moving, working pretty good. And you do the same thing to this side. Inspect it. Make sure his joints and everything is working really well. Your hand is cold over here, Josh. I notice that his left hand is, this your right hand is cold and clammy. Maybe because he's kind of nervous. Okay, thank you, Josh. And now I'm going to do the same thing with his legs. I'm going to check his legs. Are you able to raise them up? Thank goodness he's young. So he has good movement. Well, I'm inspecting his legs. I see there's hair distribution, no scarring. His legs seem to be nice and straight, so he's never broken any bones before. And he's probably getting tired of holding it for me. He can flex his foot up and down. So everything looks good. I want to palpate the pulse, popliteal pulse, relax. Behind his knee. There's no edema in his legs or his feet. Check his dorsalis pedal pulses, which are good. Same thing for this leg. Inspect it. All right. You can move your joints well. Check your pulse. Sit your feet flat on the floor. In the dorsalis pedis pulse. And then I'll just take a look at his toes. They're nice and straight. And take a look at the toenails. Good cat refill. No discoloration to his legs. And this concludes my physical assessment. Thank you.